Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism. Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
The first question, I'm going to go right to Nadia, because last week we got into a conversation about diet and biomedical and all of that stuff. And Nadia says, what's the best treatment for recurrent yeast in a 2-year-old? That's a whole episode.
The whole really
Yeah.
is. So, there's a lot that I could say about recurrent yeast. And it was actually one of the first things that I experienced before I was paying attention to biomedical issues. So back in the 90s, I guess, one of my patients, a little girl, had developed yeast on fungus on her nails. And so we got her pediatrician to treat the fungus on her nails. And he actually treated it topically. And believe it or not, it changed her behavior. So that was kind of very shocking to me. And so then I met with the pediatrician, and that pediatrician was Michael Goldberg, if you remember back in those days. And so I started talking to him about autism, and he started to also pay attention and started doing a lot of other things as well. And sorry, Shannon, if you hear barking, it's because I think the coyotes are back. And
Oh,
my
no.
dog.
Let us know if you need to do something to keep everybody safe.
We'll see. I see Blaze outside, so I think we're okay.
Okay.
So basically, long story short, after that we started paying attention and realized that our kids have underlying medical issues that are affecting their behavior. Yeast or Clostridia being one of them. And it's important to note that when you have Clostridia or yeast, it does actually can actually cross the blood-brain barrier and affect how the brain functions. So it becomes really, really important to not just obviously because of that, but also because yeast can cause a lot of mischief in the gastrointestinal system, and there's a lot of issues that come about from having high levels of yeast. So there are different ways to treat it. Some people do very well with diets that will reduce the growth of yeast. If you think about yeast as, I like to just anything, like you think about bread, for instance, and you leave bread outside, it will mold, right? Pretty quickly. So there are certain foods that are the yeast likes to grow on, like sugary foods and gluten type products and so on. And so diets are very effective. The second thing is there are medications, prescription medications that are very effective, and a lot of people are taking antifungal medications like nystatin, for instance, or diflucan. There's a lot of them, and they are extremely effective. Sometimes you have to repeatedly take these medications, and yeast can overgrow again if you're not on the appropriate diet. And then there's also less, like over-the-counter type medications that are pretty helpful from what I've heard from parents as well. So there's a combination of things. I would really recommend that you consult with a physician, and I would probably suggest that you speak to kind of a naturopath type physician first, maybe, and they might be able to help you, or a nutritionist. There are a lot of people. Julie Matthews has a lot of programs about this. I'm sure Taka has some advice on this issue, and I think that it would probably be best to start with a diet change and maybe some homeopathic type interventions. And if that doesn't work, then you will end up going to prescription medication.
Yeah. It's if you have a child who is has yeast overgrowth, and if you want to know more about it, you can just Google Candida overgrowth. I think a lot, when my child had this, and people were talking about yeast, and and I was like, what are you like a yeast infection? Like, this is something that women, have to deal with, in their lives. And I thought that's what they were talking about. And I was like, he doesn't have that equipment. What are you talking about? And but it was a whole rabbit hole that we went down, and we made dietary changes that helped. But then we eventually did, under the care of a doctor, a yeast protocol with diflucan the first time and nystatin the second time. And I don't know what the difference between the two of them is, but I know we were, and there were other medications he had to take at the same time. Made a tremendous difference. But I always like to say to people, if you are going to start a yeast protocol, yeast is a living thing and it tries to survive, and you can never eradicate yeast. We all need a certain amount of yeast in our body and in the environment. But when you try to, knock it back so that it's not in overgrowth, it will try to survive, and you will get something called a yeast die-off. So it will get worse before it gets better. And I know when it happened to us, somebody didn't warn us. And I was like, this is not working. We need to stop this. Things have gotten exponentially worse. And they said, no, that's the die-off. That means it is working. Hang in. And I remember the morning that the die-off was over. And I thought something was wrong, because my child that we called Busy Pants, who was constantly in motion, never sat still, was sitting still and playing with Legos. And I woke up my husband. I walked out, and there he was sitting at the coffee table putting Legos together. And I went and I woke up my husband. I said, something's wrong. And he came out and he was like, what? And I said, he's just sitting there. He's not running around. He's not stimming. He was just sitting there doing his Legos. And it was just eerily quiet. There were no noises, because he engaged in a lot of vocal stereotypy. There was a huge breakthrough that came with it. But I'm with Dr. Grandpichet, a good doctor. The MAPS doctors are really good at this and know what they're doing. I don't think I would try this with a regular pediatrician. I don't think that they are specialized enough to guide you through what you'll go through. Do you disagree with any of that, Dr. Grandpichet?
No. I mean, there are some pediatricians who have improved, but I agree with you, because if you, for a pediatrician, the likelihood is they might not know about this. So the first thing they'll say is, no, that's ridiculous. The second, if they know about it, then they will just go straight to prescription medication, which is fine. I mean, going to nystatin is very harmless. Nystatin is a very, very low grade antifungal medication that is given. You could give nystatin to a newborn. So it's very harmless. But once you start talking about like Nizoral and diflucan and stuff like this, then those are things that metabolize through the liver, and it would be important to keep an eye on the child every month and all that sort of stuff. So I'm not sure a pediatrician would have that level of knowledge. I do like the doctors who are much more kind of trained for autism, and so I think that's the way to go.
There we go.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.